Today we're gonna talk about neck pain, how to fix it, and more importantly, how to keep it fixed. Howdy folks, I'm Dr. Rob with Paragon Performance Physical Therapy. The information I'm gonna cover in this presentation is gonna be part of my ongoing series, Owner's Manual for the Human Body. It's gonna be super useful, super basic information that all humans, at least the ones with bodies, will find useful. Like, this stuff should have been taught in 8th grade right next to the whole birds and bees spiel. So that having been said, do me a solid, do the human race a solid, and I want you to like, comment, subscribe, and share this video with somebody that has a human body. It helps the channel, it helps my business, and it helps all of mankind. Thanks. So, I used to get neck pain all the time. Crazy, wicked, nasty neck pain. I didn't really understand it, but I'd wake up with what I called Batman neck for no reason at all. You know, Batman, Michael Keaton's Batman especially, where your neck is too painful to turn so you just bring the whole body with you. Huh? What's going on over there? Joker? Actually, Michael Keaton didn't talk like that. I think he talked a little bit more like, hey, Vicky Vale, what do you weigh? And the thing about neck pain is that it's a little disconcerting when something that close to the seat of your consciousness starts throwing a fit, and you can't help but catastrophize. Anyhow, time passed, I did my research, and by did my research, I mean went to physical therapy school and got a doctorate. But it wasn't really until I graduated from PT school that I came to grasp the real underlying principles of fixing these sorts of problems. I realized that most of physical therapy is far removed from the goofball wizardry that a lot of PTs like to preach. Personally, I'm a big fan of the KISS approach, which of course stands for keep it simple, dumbass. Long story short, came a day where I just kind of realized, you know what? Let's fix this problem. And I started building up my neck strength that day. I'm not gonna say that I haven't had any neck pain since then. Life is chaos, and jujitsu demands a sacrifice. But neck pain has been a much more rare occurrence even with me doing jujitsu and working out harder, and getting older. If you have neck pain, here are 5 things that I want you to keep in mind. Number 1, neck pain is common, and more often than not, it is utterly benign. 30% of people will experience neck pain in any given year. And out of that, only 0.5 to 2% of people will suffer any sort of disc herniation. That's the thing that most people tend to be afraid of. You know, their neck hurts, they get kind of radiating symptoms, and everybody starts freaking out thinking they got a disc problem. They slipped a disc, they blew a disc, they've herniated a disc, you know, they're gonna be paralyzed, they're gonna be crapping in a bag for the rest of their life. First off, a disc herniation is relatively rare. Anywhere from 62 to 83% of these disc herniations are going to spontaneously resorb, which means that they're going to, of their own accord, return to their original pre-herniated asymptomatic state. You're gonna be fine. Also, almost everybody has asymptomatic herniated discs, right? You can herniate a disc and it's not going to cause you any issues whatsoever. It's a fine thing to happen. 29% of people 20 years old have MRI confirmable disc herniations, which slides all the way up to 84% of 80-year-olds. Okay, so it's almost a statistical fact that you're gonna herniate a disc. There's also a really good chance that you're not gonna know about it. As we age, we get wrinkles on our face, we get wrinkles in our joints in the form of arthritis, we get wrinkles in our spine in the form of disc herniations and other quote-unquote degenerative changes. Quote-unquote degenerative changes is another way of saying normal aging. And beyond disc herniations, sure, I've had plenty of patients come in, you know, with horrible back pain or horrible neck pain or whatever, thinking that they're gonna die from it. More serious health concerns such as cancer, infections, or fractures make up less than 1% of spine pain cases combined. Another important thing I want you to take away from this video is that neck pain is similar to all other types of pain in that as psychosocial stressors rise, the pain is likely to follow. And by psychosocial stresses, I'm talking about depression, anxiety, poor sleeping habits, poor dietary habits, sedentary lifestyle where you're getting insufficient exercise, financial stress, relationship stress, thinking your boss is a jerk, you know, things like that. And if you're under too much stress, your body is gonna look for ways to communicate that to you in a way that you can't ignore. I mean, that is what pain is. Pain is a signal from your body that you can't ignore. It cuts right through everything. Essentially what I'm saying is this: if your house is not in order, your body will use pain in order to bring that fact to your attention. Which is also to say that if you start working on these things, if you start chipping away at these psychosocial stressors, if you start improving your life, that pain that you're experiencing in your neck or in your back or in your knees or in your face is going to start coming down as well. You gain control over your life, you gain control over your mind, you gain control over your body, and the pain tends to start kind of fading away. The third thing I want you to take away from this video is that more often than not, you don't need anything more than time and exercise to improve your neck pain. If you add manual therapy like dry needling, chiropractic, or massage, you'll get improved short-term outcomes like less pain and slightly improved range of motion, but the long-term outcomes of exercise compared to exercise with manual therapy are the same. So you don't need chiropractic care to improve your neck pain. You don't need a massage. You don't need dry needling or acupuncture. They can be nice, but again, if you exercise and give your neck time, it's gonna get better. That's just what the human body does. Now, on the other side of the coin though, if all you're doing is passive interventions, you're just going and getting your neck adjusted, or you're just going and getting a massage, or you're just going and getting a bunch of needles stuck in your neck, and you're not doing any follow-up exercises, you're selling yourself short, and you're gonna have this problem for a longer period of time than you would like. It might still go away. God, I hope it does. How beautiful would that be? But don't even get me started on the whole passive approach to recovery. It's not how it works. Click there, or there, but probably there, to watch a video that I've done previously about how passive interventions and passive recovery is likely to lead you into a worse condition. It's a good video. Here's the fourth point I want you to take away from this. I've been working as a physical therapist for around a decade now, and I treat neck pain the same way that I treat 90 to 95% of all the physical therapy appropriate concerns that I see. Unload, rebuild, reinforce. Take time off and do active rest. Let your body chill out and do what it does best in situations like this, which is heal. Don't ice. Dr. Gabe Merkin, the physician that originally codified the RICE protocol, has since recanted. We don't RICE anymore, folks. It screws up the healing process. You don't want to stop the flow of cells in and out of the area. You don't want to stop the flow of fluids in and out of the area. You don't want to stop the inflammation process. Inflammation is crucial for the healing process. And if you stop that, then basically you're hamstringing yourself. You're going to end up with a less than ideal outcome. During the rebuilding phase, you are rebuilding range of motion and strength while your body rebuilds injured tissues, all while addressing and reducing your pain. You're working on calming your nervous system, and you're working on your mindset. The recovery mindset is something you have to commit to. You have to be in it to win it. This is your body, goddammit. Whatever structures were injured, whatever movements were limited, whatever strength was compromised, once your pain is controlled and you're more or less back to baseline, your new goal is to maximize strength, maximize range of motion, and maximize hypertrophy or tissue growth. A great predictor of injury is a previous injury. Strength training will make you physically, neurologically, and mentally more resilient and resistant to subsequent injuries. It's a no-brainer. And for the fifth takeaway, I'm gonna show you some of the exercises that I've used to quote unquote cure my neck pain. Yeah, I know it's not cured. It's not actually cured because it still hurts every once in a while when some dude chokes me out in jiu-jitsu, or I don't know, I get punched in the head, or it's more about managing. The first set of exercises is just isometrics, okay? You're gonna perform isometric holds on all the primary movement planes, okay? So you're gonna have flexion. Flexion is bending forward. Put your hand against your forehead and push forward without moving your head. Hold for 5 seconds, relax. Okay, repeat that 5 times in a row. You're gonna do the same thing backwards into extension. I'm pushing forward and I'm pulling my head back, and I'm not moving. I'm not tilting my head back. I'm just pulling and holding. Next, you have lateral flexion. Pushing here, keeping my head right down the center line. Okay, back and forth. 5 seconds each, 5 repetitions. You're also going to have rotation. Yeah, rotation. I'm trying to turn my head with my hands, and I'm resisting with my neck. That's essentially what I'm doing there. What I love about these isometric exercises is that you can do them anywhere. I think of them as like a back pocket exercise where, you know, wherever you are, you're sitting around, you just pull it out of your back pocket, you're like, oh, I can do some of these exercises. Also, there's nothing magical about holding them for 5 seconds. And hold it for 10 seconds, 30 seconds, see if you can hold it for a minute. When you do that consistently throughout the day, what you're doing is you're demonstrating to your nervous system and to that particular set of structures back there that it's safe for you to do this. It's safe for you to use that muscle. And obviously it's not just that, but it's a useful way of thinking about some parts of the healing process. When you're doing your isometric exercises, really what you're doing is you have lateral flexion or side bending, you have flexion, you have extension, and then you have rotational movements. You can train those with a strap as well. This is just a Dyneema sling. We use these in climbing. You can do the same thing with an elastic band. Here I'm pulling forward with my arms and holding with my neck, right? So I'm not moving here. Okay, now the variation is gonna be rotational. Holding the band here, and then I'm rotating. I'm pulling this hand across my forehead as I'm turning to give it a little bit of a rotational resistance. This is also great with the resistance band. Okay, so the band is here, I'm pulling forward, and I'm just holding it. Okay, this is a pretty mushy band, so it's not giving me a lot of a lot of work for my money. What I like about the band is that you can get a little bit more movement. Okay, so I will say that I hate traditional neck bridges. They suck. Like, I get Mike Tyson did them, that was his bread and butter, and the dude is an absolute monster. He is the GOAT. That having been said, what's good for the GOAT ain't necessarily what's good for the gander. And with this exercise, the way that it loads up the neck, I just don't like it. I don't think it's great for the general population. And I'm not gonna say that it's dangerous per se, but it is heavy, repetitive, loading it into cervical extension with compressive forces, which is a great way to spike your neck. It's a great way to get the nerves pissed off. And there's better ways of doing it. Let's go over a couple of alternative exercises. How about that? These wall exercises are a great kind of first approach to doing the bridging exercises like Mike Tyson. You can do them in flexion, you can do them in extension, you can do them laterally as well. Here you can kind of see that I'm pressing, I'm kind of leaning back against the wall and just extending and flexing and going for it. I love this exercise. I've never actually seen anybody do it before. I just kind of made it up on the spot. What I like about this exercise is that as you're doing your hip bridge, right, working your glutes, you can kind of see in the neck that I'm going through an extension and flexion to neutral movement. Right, so it does simulate Mike Tyson's neck bridges a little bit better. Do 3 sets of 5 repetitions, holding each one for 5 seconds. That's how you get your toe in the door. If it doesn't spike you, if you don't get more symptoms after that, then you're probably free to do more longer holds, more repetitions, etc., and really push it. So with this exercise, you are going to slowly lower the weight and then slowly bring it back up. The way I'm doing it, it looks a little bit like a crunch. I'm not mad about that. As long as you're in control of the weight and the weight isn't in control of you, start light, get comfortable with the movement, and progress from there. If you grit your teeth, press your tongue against the roof of your mouth and look down. There's some research that suggests that that can be helpful for recruiting some of the deep stabilizing muscles of the neck, which will help build further strength in your neck. The prone version of this exercise is going to involve simultaneous cervical extension and cervical retraction. Cervical retraction is the same movement as a turtle pulling its head back into its shell. If you're using a weight like a plate or a dumbbell, I'd recommend using a towel or a toque if you're Canadian to give yourself a little bit of cushion between the steel. I'd also recommend doing a lateral flexion version of this exercise. I want you to imagine that you're trapped between 2 walls and you cannot turn your head as you're performing this movement. If there is some rotation while you're doing this exercise, it's not the end of the world. Again, we want to have a strong dynamic body, not a strong rigid body. I love shrugs. I think shrugs are one of the greatest exercises ever invented. Whether you have neck pain or whether you're just trying to get a stronger neck, shrugs are where it's at. I tend to have a fair amount of slop in my shrug technique because I do martial arts, I climb, those are very dynamic activities, so I want my levator scapula and upper trapezius and neck in general to be used to the idea of chaotic and highly variable movements under load. And other exercises that would for sure be beneficial, deadlift, any kind of barbell pulling exercise. Elliptic lifts are good for neck strength, farmer carry, suitcase carry, anything that's gonna load that sucker up, get after it. So if you clicked on this video because you're curious about the iron neck, I think the iron neck is probably a really good machine. What do I like about it? I like that it's a one-stop shop for resisted, progressive, multi-planar range of motion exercises for the neck. I don't think that there's a lot that you can get out of that machine that you're not going to be able to get out of the other exercises that I've shown you so far. But again, there's a lot to be said for a simplified approach, right? You put that iron neck on, you use it for, 10 minutes, whatever your workout's gonna be, and you can get through all the ranges of motion, you can get through all the movements, you can get through all the loading patterns that you really need to get to without having to putz around a lot with changing weights and dumbbells and stuff like that. All right, folks, I hope that was useful. I hope that was worth your time. Don't forget to like, comment, subscribe, and share, and I will see you in the next one.